The science of the hands has never been too important of a science topic. Recently, more problems have been discovered and worked on, but before all of this, the interesting part of the hand's history was the public perception of it. Early civilizations, for example, sometimes amputated their fingers or whole hands as sacrifices to their deities, or to treat gangrene. Renaissance artists studied hands very carefully. Besides art, formal studies were only performed out of necessity. Ambroise Paré invented rather rustic prostheses for arms and legs, simple but efficient mechanisms that allowed soldiers with amputated limbs to continue fighting. It's important to note that these artistic ideas are not exclusive to a Renaissance. Aristotle said that man received hands because he was most intelligent, and one of the most respected anatomists of all time, a Greek named Galen, agreed with him. Galen's work on anatomy was studied by many, and none of them really thought to challenge him until Andreas Vesalius began dissecting real humans. By now, it's a scientific revolution, so everyone is asking questions. These new questions made the church uncomfortable, so a man named Charles Bell decided he would prove God's existence to skeptics. He wrote a book exclusively about hands, using their perfection as his primary argument. Then came the Industrial Revolution, which changed public perception of the hand rather dramatically. Previously seen as cooking, letter writing, sewing, or drawing tools, hands now ran machines. Hands could get cut off by machines. This little detail began a revolution on prosthesis development and was probably one of the big incentives for the creation of anesthesia. Following the Industrial Revolution, Europe started looking for more ways to make daily life easier, leading to developments in communications technology. And on the other side of the planet, Mexico was building hospitals. The country had lived in a constant state of warfare, and the harsh conditions made it easy for diseases to spread. Also, the introduction of anesthesia to the country in 1847 made amputation and other common surgical procedures easier for soldiers. War was the norm during this period, so money was scarce. Science was a luxury Mexico was not allowed during these years. But time did not stop in the 19th century, and so science has continued to progress. We'll go back to scientific developments later with new advances in hand medical technology.
Let's leave history aside for now and talk about the science behind hands. Did you know a fetus develops its hands in early as week 7 of the pregnancy, and it takes until week 25 to finish? On week 7, adults begin to grow, and throughout the next week, they continue to grow. During week 9, the fingers are noticeable, and by week 10, fingers have fingerprints. The following week, the fingers are separated and fingernails begin to appear. By week 15, fingernails are completely formed. The 18th week is where the skin creates a protective wax layer. Meanwhile, the fingernails are still growing. Finally, bones are becoming solid, so the hand is fully created in the course of week 25. It is important to note that the hand is an extremity, so it doesn't have surrounding organs, but is connected to the arm and the wrist. The best plane to appreciate all the internal structures of the hand is the frontal plane.
What about these internal structures? Well, the hand consists of carpal bones in the wrist, then the metacarpal bones at the base of the fingers. Working our way to the fingertip is the proximal phalange, medial phalange, and finally the distal phalange. Regarding muscles, the abductor pollicis brevis, flexor pollicis brevis, and the adductor pollicis make up the thumb. The abductor digiti minimi brevis and flexor digiti minimi brevis are the muscles that are at the bottom of the digits. The median nerve is the trunk of the ulnar nerves to branch off of and give us the sense of touch.
All these internal structures perform their functions so well because they are made of tissues specific to the need. For example, squamous epithelial tissues found in skin, soft connective tissues found in tendons and ligaments, specialized connective tissues found in bones, nervous tissue is found in neurons and nerves, and skeletal muscle tissue is found in voluntary muscles.
While talking about nerves, let's consider that some of these areas are fairly sensitive, like the nails. Vitamin B2, riboflavin, is a very important vitamin for healthy nails as well as hair, eyes, and liver. It's commonly found in food such as milk, eggs, soybeans, and spinach. It is considered a complex vitamin. It is a completely harmless, but a shortage of this vitamin could cause problems.
These precautions are just on a chemical level. Third, hands are used all the time, so they are always exposed to danger. For example, Vox's fracture is a common name for a fracture of the long bone that connects the little finger to the wrist. To help reduce your chance of boxer's fracture, take these steps. Do not put yourself at risk for trauma to the bone. Avoid situations where fights may occur. Consider anger management if you have repeated anger outbursts or are prone to fighting. Wear proper padding and safety equipment when participating in sports or activities. Let's consider another disease, carpal tunnel syndrome. It is a condition in which there is excessive pressure on the main nerve. This is the nerve in the wrist that allows feeling and movement to parts of the hand. It can lead to numbness, tightening, weakness, or muscle damage in the hand and fingers. To prevent it, usually use tools and equipment that are properly designed to reduce the risk of wrist injury.
Hand healthy is for it to work properly. Sometimes they go unnoticed, but these functions are always at work. Hands help with the manipulation of objects, fingers and nails, and sensibility, particularly in fingertips, to manipulate objects. All structures inside the hand work together to achieve the same goal. The important structures of the hand can be divided into several categories. These include bones, joints, ligaments, tendons, muscles, nerves, and blood vessels. The hand is formed of numerous structures that have an important role in normal hand functions. Sensibility is only achieved by all the web nerves that we have in our hand, especially in our fingertip. When they are in contact, they send a message to the brain.
Keeping your hands healthy, a recent study made in the UK created samples, inexpensive splints that can help reduce pain. People suffer from hand osteoarthritis, although osteoarthritis is not exclusively a hand problem. These splints were specifically designed to treat this area. Rheumatologist Dr. Fiona Watt led the study, testing splints on patients from a clinic in London. The splints are made out of thermoplastic and are worn at night while sleeping. The study found that after wearing the splints for 3 months, 74% of the patients reported reduced pain.
Another team of researchers worked on a new hand prosthesis, which allows the user to recover tactile functions. The patient recovers sensibility, which in turn helps the patient's ability to control the prosthetic. This device allows the patient to recover sensibility of pressure and its texture.
Love your hands, take care of them. They do a lot for you, so please do something for them.